It's still early in this epidemic to know what all the reasons are for this disproportionate impact. We know that housing and that long-term historical institutional racism are factors. We know that disparity in access to socioeconomic resources are factors. There are any number of factors that need to be thought of and considered as we work through this. What we don't think is, we don't think that that African American people are genetically somehow more susceptible to this. It's not. It's very unlikely that it's genetics. It's far more likely that it's other socioeconomic factors that that need to be considered. And that's not new or unique to coronavirus, of course. These are issues that have affected disproportionate rates of heart disease, diabetes, hypertension, HIV/AIDS, and any number of other health issues that we've been concerned about for a long time. We are looking at how do we improve access to testing for all people in the community. Cherry Health has recently opened up more testing for anyone, and that's helpful. We know this is largely a communications struggle, and so we want to partner with you and others to make sure that the messages that are so important for prevention and for access to care right now are getting to everyone in the community. That's a priority of ours. And it's also a priority to think about what happens in the next phase. So this first phase has really been about bracing for impact with the arrival of coronavirus in our community. It's been about flatten the curve and save lives. As we move to the next phase, we need to think about how do we all thrive during the many months that exist between right now and a time in the future where we have vaccine available. So how do we reopen the economy and schools and everything else in a smart, strategic way to protect everyone in the community, while also recognizing that poverty is a health issue, and mental health is a health issue, and violence are health issues, and substance abuse. There are so many health issues that are being exacerbated by this pandemic that we all need to be mindful of and work together to find solutions going forward.